Okay, this is Sonia Brown. I'm going to do the intramuscular injection, the measuring the glucose, and mixing and administering insulin. Checkoffs. Okay, for my IM injection, I'm going to make sure there's an order for the IM injection. I'm going to make sure it's the right patient. When I go to the room, when I prepare my order, I'm going to make sure my medication is correct, the correct medication with the order. Make sure it's the correct dose. Make sure I'm giving it the correct route and at the right time, and make sure that I'm going to have the correct documentation. I'm also going to check the expiration on the medication to make sure the medication is still good medication. So to draw it up, I'm going to take an alcohol pad and I will clean the top of the vial. And I'll get my syringe out. And if I have to give 1 milligram of the medication for the right dose, I will pull up I will aspirate that much air, 1 milligram of air, into the syringe. I will remove my cap, insert, and insert the air. Then I would turn it over. And I would draw up to 1 milliliter of medication. Take it out. Look at that again and make sure that's correct. Make sure there's no bubbles in here. Then I will recap my needle. Use my safety cap and recap this needle. Remove this needle and place on a new needle. I would label my syringe to make sure if I'm outside of the room, I will label syringe so I will be able to identify it to the patient when I get inside the room. When I get inside the room, I will also perform another check to make sure this is the right patient, med dose, route, time, and to have the correct documentation for the patient. I would also introduce myself and explain the procedure to the patient. Get an IM shot. I would make sure they're educated on what they're getting, why they're getting it, and the adverse effects of it if something were to go wrong, and what to report to me as a nurse. So once we get that all done, I will ask them about sites. What site is preferable for them. I would tell them it's IM, so it's a muscle shot. So the deltoid is a good place. Vastus lataris on the thigh is a good place, or the dorsal gluteal. So for this one, we'll inject into the deltoid. I'm gonna simulate this because I don't have a person here stick. So after I explain to them all that, and we decide on the place, we will use alcohol swab to clean that area. I would get clean the deltoid in clockwise motion. Then I will remove my cap off of my syringe, and I would take it and I would inject at a 90-degree angle into the muscle, aspirate, and then slowly administrate to make sure there's no blood in the syringe. Make sure I'm in the right place. Leave the syringe in place after I've pushed the medicine into the muscle. Withdraw the needle. I'm not going to recap it. I'm going to apply alcohol pad to the site, and then we'll safely dispose of this needle. I remove my gloves, wash my hands, and then document that the patient received X medication, this dose, this route, and I will put the deltoid as the place that where I gave it at this time, and I will document that the patient tolerated the injection well, any adverse side effects or anything that came about from that. Okay. Now, moving to checking the glucose. I have my little glucose checker here and everything. So, first I would identify my patient again, review the physician's orders. I'm here to check your blood sugar for today. I will perform hand hygiene and put on some gloves, clean gloves. Have the patient to wash and dry their hands if they can. If they can't, I will do it for them, if they're a bed-bound patient. Turn on the machine and place a strip into my little machine here, my little simulated machine. And then I would choose a site. Fingers on the fingers. I would ask them because sometimes patients have sore fingers. So we'll just have to see what that is. So I use the distal end of the finger, use the alcohol swab, clean it off, and allow it to dry completely. I will take my lancet and I would stick the finger and remove the first drop of blood. Then I would squeeze lightly and put it on the machine on the end of the strip and let that display, the results display. Turn off my meter. I would clean it off. I would remove my gloves, wash my hands, and explain the results to the patient. I would tell them, talk to them about their sliding scale, how much insulin they should receive by the doctor's orders. I would assess them if it's too high or too low for hyper or hypoglycemia. In this case, if I need to do anything, and I would document all that blood sugar was this at that time, and that part. That'll be the glucose monitoring. Then I will move to giving insulin. So I have a doctor's order for 10 of regular insulin and 10 of NPH for this patient of the blood sugar of whatever we had just gotten. I would compare the medication to the doctor's order. Okay, he's supposed to get 10 of the regular, 10 of NPH. I would also check these and make sure they're not expired, they haven't been open too long, all of that. And I would look at the medication and make sure it's the correct medication. So these are good medications. When I draw up this insulin, I'm going to draw both of them up into one syringe, 10 of 10 of each. First thing I'm going to do is I'm going to identify my patient, make sure they're getting the 6, make sure I'm getting the 6 rights correct. They're right. I got my right patient, I got my right medication, I got the right dose. It's going into a subcutaneous area. I got it at the right time, and we'll document at the end what's going on. Okay, so I'm going to perform my hand hygiene. I'm going to put my gloves on, and I'm going to perform an assessment. I'm going to check for hyper and hypoglycemic signs and symptoms. I'm going to make sure if I'm giving this regular insulin, because it's a short insulin, they're going to eat something soon so they won't bottom out on me. I'm going to ask the patient, where did you get, if I can, if they're able to tell me, where did you get your last insulin injection at, so we can rotate sites. Or if they can't tell me, I would check the medication administration record for the last time and where it was given. I also look at the skin in those sites and make sure those skins are not excoriated or messed up, anything contraindicated for me giving that insulin in that site. So again, I'm going to check this insulin and make sure I got the right insulin. I got my regular, I got my NPH. It looks good. It's not expired. We're going to roll these vials. Make sure we have all this mixed. Okay, so and then one syringe, I'm going to draw up 20 of air, because 10 is going to go into one vial and 10 is going to go into the other vial. So we'll do 20 exactly. The first one we're going to go into is the cloudy. So remove this, and I'll inject, make sure I got my 10, inject 10 into here, making sure not to touch the solution, and we'll inject 10 air into here. Then we'll remove that. Then we'll inject the other 10 into the clear, which is short acting. And then we'll turn it over. And out of this regular clear, we are going to pull 10 and remove that. And then we'll insert the needle into the cloudy. And we're not going to push anything in, but we're going to remove the final 10 to the 20. There we go. Once we do that, make sure there's no bubbles in here. No bubbles in here. Okay. All right, and then we'll replace this good safety cap. And we'll label this as 10 of regular and 10 of NPH, insulin. And I will verify that with a second nurse. Once I go to the patient's room, I will identify myself. I will identify the patient. I would go over the medication again with them, checking to make sure we have the right med, the dose, the route, and the right time to give it to them. And we're going to make sure they understand what this medication is for and what it's going to do. Make sure they're going to eat. We're going to go over all this stuff again. And then we'll identify a spot. They'll say, I got it on my arm the last time. I want you to stick me in my stomach. I'll say, well, we'll look for some subcutaneous fat. I have plenty of subcutaneous fat, so we'll use that. If the person is a small person, you'll want to inject at a 45-degree angle. If it's a person with a lot of subcutaneous tissue, you want to go in straight at a 90-degree angle. So once we identify the spot, take our alcohol swab. We'll clean the area in circular motion. Turn around. Then we'll take our needle to our patient, and we're going to slowly administer that into there at a 90-degree angle. Can't see that. There we go. 90-degree angle. Once we administer the medication, we'll withdraw the needle. Wipe that off with the alcohol swab. And we'll dispose this in the safety bin. We'll remove our gloves. We will wash our hands. And we will document that the patient received 10 of regular, 10 of NPH subcutaneously into the abdomen on the left side, which is this side I'm using, the left side. And patient tolerated well. And we'll document all that. And that is the end of mixing the medication administration and the blood glucose checks and the mixing of the insulin.